Dear students, look at the picture. What is it? You can recollect by looking at this part. Try to recollect. So what is that you are seeing now? It is the goose. Then what part of goose is represented here? You are able to see the feet of the goose and then correlate it with the structure you are seeing here. So the webbed feet of goose you are seeing here, and the name given to it is the PES anserinus. PES anserinus is the goose feet. That is, this word PES anserinus has come from Latin, which means goose feet. So what is its connection to the anatomy? We will see. The etymology of the word anserinus, PES anserinus. So it's a Latin word which means goose foot, and this word is used for its similarity in relation to the pattern of tendons in the lower limb and in relation to the pattern of branching of the terminal branches of the facial nerve in the face. So in this picture you are seeing the tendons of sartorius, gracilis and semitendinosus and their insertion in relation to the anteromedial surface of the tibia. And in this picture you are seeing the facial nerve course, that is the extracranial course, that is after it has come out of the stylomastoid foramen. The branching pattern of the facial nerve in the face, it also resembles the goose foot. That's why this is also PES anserine pattern of branching of terminal branches of facial nerve. Now look at the picture. So in this picture you can see the facial nerve coming out from the stylomastoid foramen and then entering into the substance of the parotid gland, and at the anterior border of that parotid gland it divides into the 5 branches. They are known as the temporal, zygomatic, buccal, marginal mandibular and cervical. So if you look at this branching pattern of the terminal branches of the facial nerve in the parotid gland, it resembles the webbed feet of a goose, and that's why it is also known as the PES anserine pattern of the facial nerve in parotid gland. Now we will limit our discussion to the PES anserinus appearance of tendons of a lower limb. So now you know what is PES anserinus. So in relation with the lower limb, it refers to the conjoined tendons of 3 muscles which will form a web that gets inserted into the anteromedial surface of upper part of tibia. And you are already knowing those 3 tendons. So in this picture you can see the tendons, the sartorius, the gracilis and semitendinosus tendons that are getting inserted onto the anteromedial aspect of the upper part of tibia. Let us see a clinical case scenario to understand the importance of the PES answerinus. A marathon runner comes to the OPD with a complaint of swelling and pain on the anteromedial aspect of upper part of leg. That is pain is more while running or taking stairs. So he has come with that complaint. And on examination, a visible swelling is seen on the anteromedial aspect of the knee. And there is a tenderness on palpation at a point about 2 finger breadths medial to tibial tuberosity. So these are the presenting symptoms of a case with pain in the upper part of leg in a marathon runner. The investigation that was advised was MRI of the knee, and based on the MRI picture, it was diagnosed as the PES anserinus bursitis. In this picture, you can see the 3 tendons, that is the sartorius, gracilis and semitendinosus tendons that constitute the PES anserinus, and deep to it we are seeing the bursa that has connection with the knee joint, and this bursa is known as the anserinus bursa or PES anserinus bursa. And in the MRI image, you can compare it with this drawn picture. So this is the PES anserinus bursa, which is inflamed bursa, and that's why it is known as the PES anserinus bursitis. After describing the case scenario, let us answer the questions. What is PES anserinus? Now it is easy for you to write the answer for the PES anserinus. It's nothing but webbed or foot-like insertion of conjoined tendons of 3 muscles onto the anteromedial surface of upper part of tibia. So it is the goose foot-like appearance of insertion of conjoined tendons, the 3 tendons of the muscles, the sartorius, the gracilis and semitendinosus onto the anteromedial surface of upper part of tibia. So the pattern of insertion is called the PES anserinus. Now the next question is, give anatomical description and clinical importance of PES anserinus. We can describe it regarding its uniqueness of the tendons that are constituting the PES anserinus and their insertion, the arrangement of these tendons, relations of these tendons, and then clinical importance. So in relation with the PES anserinus bursitis or tendinopathy, the case scenario with which we have started the discussion. Now let us consider the peculiarity of the PES anserinus. The union of these 3 tendons is unique. Why they are unique? Because they are coming from different compartments of the thigh. For example, the sartorius It's a muscle of anterior compartment, that is flexor compartment, and supplied by femoral nerve. And the gracilis, it's a muscle of the medial compartment of thigh, that is the adductor compartment, and it is supplied by obturator nerve. Then the semitendinosus, it's a muscle of posterior compartment or extensor compartment, and is supplied by tibial part of sciatic nerve. That is the uniqueness of the PES anserinus. And another uniqueness is their origin. They are all originating from the pelvic bone. Then coming to their insertion, which is also unique, and they are getting inserted in the form of a extended expansion. So like the goose feet on the anteromedial aspect of upper tibia. If you observe these pictures, you can see the tendons of semitendinosus muscle, then the gracilis muscle and sartorius muscle. So from posterior to anterior, we are seeing the semitendinosus, gracilis and sartorius. Sartorius is the anterior one, and in the middle is the gracilis, and posterior is the semitendinosus muscle, and their expansion and insertion onto the anteromedial aspect of the tibia you are seeing. And here also you can see. So each of the tendons, they are getting expanded like the goose feet when they are nearing to their attachment. That is, you can see the sartorius and then the gracilis and semitendinosus from anterior to posterior. So that is the uniqueness of the PES anserinus. In this picture, you can see the attachment of the tendons onto the tibia in an anterior to posterior direction, starting from sartorius, gracilis and semitendinosus, and they are acting like guy ropes. It is the arrangement you are seeing. At this point, let us consider certain functional considerations. So the PES anserinus is inserted onto the anteromedial aspect of upper part of tibia. That's what we have learnt. And there will be a counterbalancing mechanism on the anterolateral aspect of upper part of tibia, which is by the iliotibial tract, which is an aponeurotic sheet, and the contributions for the iliotibial tract are the gluteus maximus, the tensor fasciae lata, and few fibers, that is the aponeurotic expansion of vastus lateralis. And what are the similarities between the two? And one similarity is the PES anserinus has 3 tendons, and then the iliotibial tract is also having contribution from 3 muscles. The contribution from vastus lateralis may be of question. And what is the origin of these contributions for the iliotibial tract? The gluteus maximus and tensor fasciae lata are from the pelvic bones. So that is the similarity between the PES anserinus and the iliotibial tract. So the origin of the muscles is from the pelvic bones, and they are getting inserted into the upper part of the tibia, one on the anteromedial, one on the anterolateral aspect of it. And both these are crossing the hip joint and knee joint. Not only that, they are acting on the both hip and knee joints. Now, what are the relations of the pes anserinus? These three tendons that are contributing for the pes anserinus are superficial to the tibial attachment of the medial collateral ligament or the tibial collateral ligament, and then they are also superficial to the anserine bursa. So the anserine bursa is between the tibial collateral ligament and the pes anserinus. Now let us see what is pes anserine bursa. It's a muscular bursa that will be lying between the tendons of pes anserinus and the medial ligament of the knee. Here you can see the pes anserine bursa, and it has got communication with the knee joint cavity. Now let us see the clinical importance of it. So the inflammation of the tendons is possible. It is known as the pes anserinus tendinopathy, or there will be irritation of bursa and its inflammation because of overuse or injury, as in the present case scenario. So then you call it as the pes anserinus bursitis, that is inflamed bursa, which can produce the symptoms as we have seen in the present case. So you can see the pes anserine bursa, normal one, and an inflamed bursa. In case of pes anserinus bursitis or inflammation of the tendon, that is the tendinopathy, there will be pain in the medial part of the knee, and which will be more with the bending of the knee, or when bending or straightening, when climbing up or getting down the stairs, and in athletes. There will be weakness around the knee, swelling over medial aspect of knee. There will be decreased range of movements of the knee. Hope you understood about the pes anserinus and its clinical importance. After learning about the pes anserinus, answer the following MCQ. Pes anserinus includes all the following tendons except sartorius, gracilis, semitendinosus, semimembranosus. The correct answer is semimembranosus, because this is not included in the pes anserinus.